The Private Medical Records Program, transforming VA claims processing and improving the veteran experience. Improving the veteran experience and ensuring timely access to critical benefits and services is at the heart of the Department of Veterans Affairs mission. And when it comes to improving access to disability benefits, increasing the speed and efficiency of the claims development lifecycle is an essential piece of VBA's transformation efforts. Today more than ever, VA is improving claims development processes and using new tools and approaches to support faster claims decisions at every level. An essential part of this effort is the Veterans Benefits Administration's Private Medical Records, or PMR, Retrieval Program. Launched in 2010 as part of VBA's claims transformation, the PMR program improves the process for retrieving private medical records to increase the overall speed, accuracy, and quality of disability benefit claim processing. The PMR program has 5 main objectives. Shorten the amount of time it takes to gather veteran private treatment records from providers to 12 days or less. Receive or close out 90% of medical record requests. Improve the intake process by digitizing medical record receipts for upload into the Veterans Benefits Management System, VBMS. Save VA employees time to focus on other claims-related activities. And better serve veterans and their families. Initially launched as a pilot in 2010, the PMR program was deployed nationwide in 2014. It now supports all 54 VA regional offices, the pension management centers, and the appeals management center. It also works in collaboration with the National Work Queue Workload Management Strategy and the Centralized Mail Program. This seamless integration into VA's electronic claim initiatives allows for the timely receipt of private medical requests via VA Form 21-4142 and the transmission of records to VA, which improves the overall speed, quality, and efficiency of claims processing. How's the program doing? In one word, great!
The Private Medical Records Program helps us make claims decisions faster, more accurately, and improves the overall veteran experience. The PMR program walks the walk. Underneath traditional claims processing, it took 60 to 90 days with a reduced success rate to get records. Underneath the PMR program, it takes 12 days and we get your records with a 90% success rate.
Our goal for receiving and closing the medical records request are 12 days or less, and we're meeting that goal, sometimes even exceeding.
Between 2010 and 2016, the program processed hundreds of thousands of requests and achieved a cumulative 90% success rate in obtaining records or responses from providers. Bottom line, the PMR program has centralized the medical record retrieval process. And what does that mean for veterans? Faster, more accurate claims decisions. Improved customer service, improved access to benefits and resources, and overall, a better veteran experience with VA.
I filed a claim within the last year that took probably about 2 months to complete, where I had filed claims previously that took as much as 2 years to complete. I filed a claim with VA, and shortly after that I received a letter stating that they would be requesting my private medical records. And I believe because of that, I was able to get a result from them in a very short amount of time, which I was, as a matter of fact, quite pleased with.
The PMR Processing Center makes the overall claims process faster by speeding up the gathering of evidence step and retrieving private medical records more efficiently. How does the PMR process work? VBA is taking advantage of the latest technology, tools, and program management processes to improve the quality, efficiency, and security of how information is retrieved, processed, and stored. The program integrates seamlessly with VA's centralized mail process, so that all VA Form 21-4142 requests are quickly and securely transferred to the PMR Processing Center. Incoming medical record requests are then thoroughly reviewed to determine if they qualify for development. Each request undergoes a rigorous quality assurance check for validation. Once complete, an initial contact letter is sent to the veteran and claimant's power of attorney, if applicable, notifying them that a request has been made to their provider. Contacting the veteran keeps them informed and connected to their claim by improving transparency within the process and promoting communication with VA. Over 2,000 veteran letters are printed and mailed each week. Claims service representatives, or CSRs, will then directly call the private healthcare provider listed on the form within 3 business days of receiving the request, and follow up with multiple calls as needed.
Good morning. My name is Tania, and I'm calling from the Veterans Benefits Administration, and I'm calling to obtain the fax number to send over a medical records request for a patient.
This proactive approach provides direct outreach to providers and builds stronger relationships with them to gather evidence faster than previous methods. Call scripts have been optimized to overcome common objections from providers to secure records quickly and effectively. Providers are then faxed or mailed, if they do not accept fax documents, a formal request to submit the veteran's medical records. They are given multiple options for how to send the records, including secure toll-free fax, secure electronic upload via the PMR vault using a unique passcode, and mailed paper copies. This allows providers the flexibility to use the method most suitable to their environment, decreasing turnaround time and increasing response rates. Paper records sent via the United States Postal Service are quickly scanned and uploaded into the PMR portal to align with electronic processing initiatives and support organized internal process workflow. Hard copies are then stored in a secure warehouse and kept for 365 days before being destroyed in compliance with VA standards. As an outcome of the PMR program, relationships have been established with Release of Information, or ROI, services. These national companies serve as records request processing centers for healthcare providers. The ROIs allow PMR staff to access their online portals to pull down electronic records on a daily basis, which helps streamline the PMR process and align with VA's shift to electronic claim processing. Quality control checks are performed on all received PMRs to ensure information accuracy. Records that fulfill all requirements on the quality control checklist are then packaged and electronically sent to centralized mail for subsequent upload to VBMS for further processing. This integration with centralized mail and VBMS completes the PMR program's ability to perform the entire receipt of evidence process, eliminating it from VA rating specialists' workloads. From start to finish, this process takes an average of 12 days.
I've been with the PMR program from the early stages, and I've seen it grow from a very small pilot program at 3 offices to a nationally implemented program that receives thousands of records a day. By having a specific group of individuals focus on nothing but getting private treatment records, we can use our more experienced VA employees to focus on making complex claims decisions for veterans in a more timely and compassionate manner.
The VA backlog has really cleared up, and I think it has a lot to do with the PMR program. I'm really proud of it.
The PMR program has played a critical role in helping to reduce VA's claim processing time and the claims backlog. Through its continued efforts, the PMR program will serve as an important resource for ensuring veterans timely access to benefits for years to come.
If I could say anything to the people who work at VA, it would be thank you for your service, because they're always thanking us for our service, but they have raised the level of their performance to such a degree that they stand second to none, and I would recommend them to anyone.